The beginning of labor pain starts like an intense menstrual pain that comes and go at interval. You're welcome to Pregnant Care. Here, I prepare you for what to come during pregnancy and I walk you through it. So, if you'd like a simplified video that doesn't have so much science but rather is aimed at making you know what you need to know, then you want to subscribe to this channel and please like this video. My watchword here is motherhood activated, patience activated, and love is all you need. Like I said earlier, labor pain starts like an intense menstrual pain. That is the start of an intense menstrual pain that comes and go at intervals. The intervals at the beginning used to be very far apart. Now, one thing you need to know about labor is that you need to be up to 10 centimeter dilated for the baby's head to be able to come out of you. Now, this dilation differs in people. There are some people that they've not even started active labor and they're already up to 6 centimeter dilated. Meanwhile, some people have started active labor for the past hours and they are only 2 centimeter dilated. It solely depends on your body. That is why it is advised to take fruits that can help you to soften your cervix before you go into labor. Now, what should you do the moment your labor starts? Should you run to the hospital? I would advise you not to, because you will be safer and more comfortable in your house until you notice that your contraction is now like 20 to 15 minutes apart. But this is for people who are in a very civilized environment, who has cars, major means for movement, and they can reach out to their hospital the moment they see that, okay, this thing is getting serious. Because if you're in an area where you have to struggle to get a car, you don't even have your personal car, your hospital is farther, I would advise you start going to the hospital. One of the reasons why I said earlier that first don't go to the hospital is, even if you get to the hospital, they won't do anything. They need to make sure before they can start attending to you, your labor, your contraction has to have closer intervals. It should be as close as 10 minutes apart, 15 minutes apart. That's when the nurses will start taking you serious. Not taking, they will always take you serious, but that's when they will start taking time to like focus on you, that now I think this woman is getting ready to have a baby. But if your contraction is still over 30 minutes apart, 40 minutes apart, an hour apart, they will still just leave you there. They can book a room for you and just leave you there, that okay, just stay here, let us know when it is now 10 minutes apart. Now, booking a room for you, staying in the bed is not going to help your contraction. It is better you walking around, moving around, walking if you have work to distract you. And most of the times, these things are easier in the house. That is why it is advisable to stay in the house. But what if transportation is not so easy for you? So I would still say maybe you should go to the hospital the moment your labor starts. My previous video, I mentioned what you need to know to be sure that, oh, my labor has started. You will have a show. It's either your water will break or you have a mucus blood in your pee. Now, these are the major two signs of show I am very much aware of. Now, when you have show, you know that your labor is about to start. Then no longer after that, you're going to start having that intense menstrual pain. But believe you me, it's going to graduate away from intense menstrual pain and turn to something else you don't even know. But at least that is just the start of it. Now, what should you do when your labor starts? I've talked about whether or not you should go to hospital immediately. Now, let us go to other things you should do. Start your prayer, start your affirmation, start your declaration, start speaking into your life. It is well with my soul. I will not be tired. I'm going to have my baby healthy and strong. Start saying those things immediately. Start praying, start committing yourself into God's hands. And another thing you need to do is you need to eat, because the moment you have your baby, you're going to be very hungry. And if you're going to have your baby in the middle of the night, you're going to spend the whole night hungry. But luckily, if you have it in the afternoon, then you can get something to eat. But nevertheless, you can just find something to eat when at the interval of rest. I said it comes and go. The moment you have like a short rest, make sure you're not hungry. And when your labor finally starts and it gets intense, feel free to do whatever you want to do. What I mean is, feel free to shout if you want to shout. Feel free to sing if you want to sing. Like, express yourself. If you want to talk too much, keep talking. Just keep saying things. But never forget that don't curse. Never curse. Just say things. It's better to stay neutral. Just say things. Oh, this pain, it is well. Hey. If you want to say yay, do yay, like shout, like express yourself. Like, it doesn't make the pain easier, but if you're expressing yourself, it is one gap easier than you're trying to endure. And now, this time around, I'm immediately talking to the endurance lords. You want to endure. I know some people are very good at enduring. I get it. But then you have to express yourself. It will make it feel like it is easier. I don't know. It's not easy at all, but just express yourself. It just makes it 1 centimeter, one step better than you're trying to endure it. Anyway, some people get high endurance power. If you do, then Kudos and love and strength to you though. Anyways, so like I said earlier, pray. You've eaten, you've prayed. Now another reason why I did not want to advise that you should go to the hospital earlier is if you go to the hospital earlier, they will have to keep checking your dilation for you, compared to if you're at home, no one is checking your dilation, and you just observe the minute intervals by yourself or by your partner that is with you, someone with you. But if you go to the hospital, they will have to keep checking your vagina, and they will keep checking, and they will keep checking, and they will keep checking. Now imagine that the nurses are changing. For instance, if your labor is taking more than a day already, now you have a different nurse in the morning shift, you have a different nurse in the afternoon shift, you have a different nurse for night shift. Now these different people will keep checking. Doctors will come, they will check. It's not that comfortable for you. It's not going to be. So that's why it's advisable to go when your intervals are farther, when they can check and they see that, oh, you're over 7 centimeter gone already. You won't have to keep it. But imagine you go to the hospital at 1 centimeter dilation. See, they will check and check and check and check, and it's not so comfortable. You're not going to feel so comfortable about it. But it doesn't matter. Now that you're watching this video, you can just put it at your brain, inside your brain, that okay, they'll keep checking me. So let me accept it mentally so that it won't affect that one alone, won't even be a problem. And it is possible you want to poop too. Feel free to poop. Keep pooping. Keep pooping. Use the toilet. No, you can't use the toilet actually, but poop as much as you can. Even when you now start your intense and active labor and it is time to push your baby and it is poop that is coming out, poop the poo. You get, while you're pooping the poo, your baby is also finding his or her way out. That is, be sure about that. So I've said earlier, feel free, pray to God. Don't forget to pray to God. Speak your affirmation. It is well with my soul. Shout, scream, do whatever you want to do. Just keep saying it is well with your soul. You're not going to be tired. These things are words you need. The moment you start saying them, you believe them. Some people advise that you have, during that period of your intervals of contraction, you have lower back pain. But for me, it didn't work for me. It just felt like stress. So I didn't bother. The moment they started, I just like, please just it's okay. I don't feel comfortable having it. But if it works for you, lower back massage, your lower back, then the massage it, then it's all fine by that. So don't forget to call on Jesus. Just keep calling on Jesus. You can say, Jesus, just do whatever you want. Just feel free. So finally, you are 10 centimeter dilated and it is time to go and have your baby. Then push and tell yourself, I'm not going to be tired. Then you keep pushing, then you call on Jesus again, then you keep pushing, then you keep pushing, then you call on Jesus again. And finally, your baby is out. Congratulations, it's a blessed baby. Your gift is here. Thank you so much for watching this video till now. These are okay. Don't forget to subscribe to this channel and like this video. Please do like this video and subscribe to this channel. See you in my next video. Bye.